The first year is really foundational. So there's a fair amount of working on the pediatric floors in the hospital with the hospitalists. There's a foundation with your first rotation in NICU and then time in clinic. So it's really broad-based and foundational. The second and third years really change in terms of increased independence, increased responsibility, several rotations where there's supervision that you are providing as the resident to one of the interns or a medical student. And then there's also, as you advance through the residency, more opportunities for electives. So every resident will have an opportunity to have 6 4-week electives where they can individualize their curriculum and pursue specific interests or more knowledge in an area that they're feeling a little deficient in, et cetera.
Residents will spend their time in their primary care clinic, so their weekly or regular clinic that they see their own patients will be at a federally qualified health center in Boise. They'll also get the opportunity to rotate at St. Luke's Children's Hospital, which is where they'll do pretty much all of their inpatient rotations. They'll get to work with subspecialists in subspecialty clinics. They'll spend time in both urban settings and rural settings.
Inpatient medicine is a really fun medicine to practice. It's busy, it's challenging, and we want our residents to experience that efficiency and level of skill that they need to have to kind of manage multiple patients in an inpatient setting, whether that's in the emergency department, on the general pediatric floor, in the pediatric intensive care, or the neonatal intensive care units. These are going to be very busy environments, working and collaborating with lots of ancillary staff, nurses, one-on-one with your attendings, all at the same time always going back to your patient, going back to that patient's family, and so making sure that you're navigating a very busy space, but usually once you're in the inpatient setting, those patients have a higher level of acuity of illness and care, and so they're sicker kiddos and they need more dedicated attention, and time is usually of the essence in those types of settings. And so we want our residents to have that experience of kind of that fast-paced, busy but fun and challenging environment of inpatient as well.
If it is an inpatient rotation, such as pediatric hospitalist, NICU, PICU, et cetera, then they will really be very hospital-based. And our plan is to actually do what is essentially a modified X+Y schedule. So the goal being that instead of 1 or 2 days a week where you're in the hospital in the morning and then having to race off to clinic in the afternoon and trying to split your time between both and worried that you didn't finish things up in the hospital, we're going to organize our clinic days so that they are contiguous for a given 4-week block, so they're back to back, and you're only in clinic that day, and the days that you're not in clinic, you're in the hospital the whole day. So you're only beholden to one place on any given day. There's also going to be 4-week rotations where you're clinic-based, and you're in your continuity clinic for the full time. You're building up your continuity clinic base and getting a sense of what it would be like to be a primary care pediatrician, primarily working out of a clinic setting. And then there's going to be some of the 4-week rotations, such as the rural rotation and electives, where it's just going to really depend on where you are.
Not only will you get training in a city where you'll have a lot of the exposure to academics and specialists, there will be an additional focus on community pediatric care and advocacy, especially when you're in like this capital, Boise, but also getting to go out into rural areas and see some of the struggles faced by rural families and children, and then go back to a city and be able to use your resources to advocate for change.
Residents absolutely have the opportunity to participate in and publish research. I serve as the research medical director at St. Luke's for Children's Subspecialties Research, and we've already begun preparing for opportunities for residents to participate in research or design their own project. We have institutional review board support, and we would absolutely love to mentor and support such projects.
I find that everybody is very collegial, it's non-hierarchical, people work really well together. The way that residents are seen is not as underlings, for lack of a better word, but really they are seen as an integral part of the team. Their decisions are respected. It's thought that they know their patients best. They make decisions about patient care on a regular basis, and without them, the team wouldn't function.